My Lords, I support Amendments 233, 234 and 235 in this group in the names of my local friends, Baroness and Baroness Greencross, and the notice of attention to oppose Clause 140 in the name of the noble lady, Baroness Reader. The two sets of amendments propose less punitive charging regimes for social care users, and the notice to oppose reverses the regressive changes to the existing provisions. I'm supporting all of them to highlight, on this occasion, the unfairness of the government charging formula on one particular group in society, working-age disabled adults. Government amendments to the Care Act disproportionately affect working-age people, especially those with lifelong disabilities who draw on support for their day-to-day needs. It is no secret that I have long campaigns against such charges. Amendments 233 and 234 propose a zero charge on disabled people between the age of 18 and 40. And Amendment 235 replicates the Dilnot proposals, adjusted for inflation. My Lords, care and support for those who depend on it is no less fundamental than healthcare in survival. Without my care assistant to help me eat, drink, move, and breathe, I would die. So I would if I did not receive medical care. Without access to support, I could not contribute to my community, I could not work or enjoy life. But to live like my non-disabled peers, I would have had to pay for my care until I reached an £86,000 cap from the age of 18. In effect, it is a financial penalty on disability. Before charging was introduced, working-age disabled service users could save for their first home, provide for a family, fund a university education, and afford all the extra costs of disability, like housing adaptations or an accessible vehicle, to thrive as equal citizens. I was very lucky, my Lords. I grew up during that time, which afforded me the opportunity to aspire to the same ideals as my non-disabled peers between 18 and 40. Coming from very humble beginnings, I didn't have a financial cushion, but I worked hard, saved like crazy, and spent wisely. All the characteristics that this government wants its citizens to emulate. And look, the policy succeeded, largely due to a then no charging policy. So here I am today, participating in vital scrutiny, equal amongst my peers. If I'd been born 25 years later, it would have been a very different story.
In his foreword to the government's disability strategy, the Prime Minister says it's in the government's determination to level up the country so that whoever and wherever you are, the spark of your talent and potential can be connected with the kindling of opportunity. Yet, this bill introduces a social care means test which drives disabled people into poverty and places a cap on aspiration. Those with assets of less than £20,000 will continue to pay out of their income towards the cost of their social care. This includes pensions, means-tested benefits, and extra costs benefits such as personal independence payment, disability living allowance, and attendance allowance. They are all regarded as income in the social care means test. Local authorities will undoubtedly raid these entitlements, intended to fund additional disability costs to pay for social care. The charging reforms do nothing to address this injustice. Consequently, those without means, unable to supplement their income through work or savings, will be forced to go without vital support. With the hike in energy bills next April, some will also go without fuel. Charging for care will prevent these young people from getting on with life and building up a nest egg. Once their savings reach £20,000, they will be looted and their future security denied. Take Sarah, age 34. She has a learning disability and lives in supported housing with social care support for meals, budgeting, and running a home. She gets housing benefit for her rent, but with no assets and unable to work. Sarah is reliant on disability benefits for all other essentials like food, fuel, council tax, social activities, and clothes. She's been paying £81 a week towards her care package, but last April, the council told her this would increase to £125. It will take Sarah 13 years to reach the cap, living on only £160 a week. If she were under 25, it would be even less, £141. Sarah will pay the same as someone with assets of £55,000. My lords, how on earth can this be described as fair? Sarah and thousands of others like her will not be living. They will be barely surviving.
In his second reading speech, the Minister said the government recognised that their amendment to the adult social care charging system was considered controversial. However, it is necessary, fair and responsible. My lords, what is fair about holding down disabled people in poverty? What is responsible about limiting their ability to survive and prosper? Rather than liberating them, this charging policy will undermine their well-being and lock them in a state of avoidable and costly dependency. So may I ask the Noble Lord, the Minister, to work with disabled people's organisations and myself and my colleagues before report stage to find a fairer way to enable these service users to thrive and to consider essential care and support services as a long-term investment rather than a drain on the exchequer. I urge members across the House to support these amendments and in doing so offer younger working-aged adults with care and support needs equal life chances.